A lot of people ask me, what is a root canal? Is that when they take the roots out of a tooth? It kills it, right? A lot of questions persist about this stuff. So let's explain it for a few moments, and this way it'll make a little bit more sense to you. A tooth has two parts to it. It has the part that's above the gum line that you normally see, and then there's the part that's below the gum line, the roots, that anchor the tooth into the gums and the bone and help hold it in place. Inside of those roots, there's a pipe, or we'll call it a canal. And inside that pipe, there's a very tiny nerve, a vein, and an artery. And what those do is they provide blood supply to the tissue that is inside the tooth that tells us what something feels like, if it's hot or it's cold or it's sweet. That nerve, in conjunction with the vein and the artery, is called the pulp of the tooth. So when someone says that you need a root canal, what's happening is that nerve, vein, artery, and all of the pulpal tissue is removed from the inside or from the canal of the root. And that's why when you hear a root canal, we keep the roots, we take out the nerve, and that's what people refer to the pulp as, and then we seal up the space where the nerve was. We shape the space and then seal it to prevent bacteria from getting into the area and allows the tooth to heal. Quick question that I get asked is, do I need a root canal, or when do I need a root canal, or what would make me need a root canal? Well, there are a couple of different answers to that, so let's look into that. First, if you have a cavity that is deep enough that the bacteria have penetrated the nerve of the tooth and infected it, that's a reason to have a root canal done, because you can't simply put a filling in the area. The tooth will flare up and be very uncomfortable, or it will die and cause an infection. Which leads us to the second reason that people can need a root canal. A nerve in a tooth could have died, and that can sometimes be very quietly over a long period of time, or very suddenly, in which case you're really aware of it because it's quite uncomfortable. But when the nerve in the tooth dies, it can get infected, and then that will show up on an x-ray, or you may notice a swelling on your gum or in your face. When you have that happen, that means that the nerve be removed, or you can attempt to salvage the tooth with a root canal treatment. What's another reason for a root canal? Well, if you take a fall and you break a tooth and the nerve in the tooth is exposed, more than likely that tooth is going to require a root canal. So traumatic injuries, cavities, and bacterial infections are the three major reasons that people need root canals. Occasionally, the fourth reason for someone needing a root canal would be if they need to have some dental treatment done on a tooth that's not in a proper position, and putting that tooth into the proper position would encroach upon the nerve space. That would be the fourth reason that someone would need a root canal. But generally speaking, it's usually a cavity, an injury, or an infection. I heard they're pretty terrible. I heard they're even worse than an IRS audit. Well, can't speak to the IRS audit, but what I can tell you is that don't experience discomfort when they have the root canal procedure performed. In fact, I've had plenty of patients literally fall asleep while I've done root canal for them. But then you might think, well, I've heard such terrible things about root canal and how painful it is. And why is this guy saying that root canal is not painful? Well, Because if we think about it, root canal became a common practice in the 1950s, so quite a number of years ago. And back then, when we started basis to help people save their teeth, we ran into some issues. First of all, anesthetics were terrible back then. You know, we talk about Novocaine, it was awful or non-existent. Then we think about, well, what has to happen during a root canal? We have to go in there, we have to get access to the nerve. So we have to drill a hole in the tooth in order to do that. But wait a second, in the 1950s, we only had those drills that felt like jackhammers to go in, and we had to use those. So imagine it like this. You're in pain because your tooth is hurting you and it needs a root canal. You go into the dentist who has a lousy anesthetic, and then he has to go in, and after you've been poorly numbed, has to turn around and use something that feels like a jackhammer until he can get down to the nerve and remove it from your tooth. Now, I don't know about you, but that sounds pretty darn painful. And that is where root canal's bad rap came from. So nowadays, we have high-speed drills, we have great anesthetics, and a lot of different techniques to help make sure that you're numb and comfortable for this procedure. You know, when you think about it, if a tooth is so badly damaged that it needs a root canal, the only alternative is to remove the tooth if you don't do the root canal. So it's important to recognize, while it doesn't sound like a fun procedure, doing a root canal is a great way to keep your natural tooth in your mouth. A lot of people will ask me, you know, I was told I need a root canal. I'm worried. Is that going to be like a lot of visits and a lot of pain and discomfort, and what's going to happen? And lots of other questions. But the bottom line is the following. In most cases, a root canal procedure can be completed in 1 to 2 visits, depending on the complexity. For us, it's more important to do the job properly than to do it quickly, but oftentimes we can do both. Does that visit take a couple of hours? Do I have to bring a lunch with me? Nothing of the sort. Most root canal procedures are completed within an hour to an hour and a half, if not less. So we have a procedure that is both comfortable for the patient and can be quickly achieved with a great long-term result.